On the occasion of World Heart Day, we have Dr. Mrinal Kanti Guha from Kolkata with us to guide us on how to keep our heart healthy. Welcome, Dr. Mrinal Kanti Guha. Doctor, how can patients recognize the early warning signs of heart disease?
Yeah, early warning signs of heart diseases can appear in different formats. So patients can remain asymptomatic as well as patients can feel mild symptoms like typical or atypical chest pain in the hands, jaw, at the back, and the central chest. And the patients can have a little bit of fluttering of the heart, like irregular heartbeats patients can feel. Patients can have compression in the middle of the chest. And some patients can feel like sort of giddiness or some sort of fainting attacks as well. Patients can feel very much fatigued. There are many typical and atypical presentations. But each and every symptom should be really taken care of, and everyone should remain alert about this sort of symptoms that can appear.
Doctor, can stress really trigger a heart attack?
Yes, stress is something very important. In terms of producing heart problems and heart attacks, both directly and indirectly. With stress, some sort of stress hormones go up that can cause rise in blood pressure, that can, work adversely on the heart, that can lead to heart attack. And indirectly, also stress can lead to so many problems. Like if someone is under stress, then naturally it can lead to so many irregular lifestyle habits like irregular sleeping, irregular dietary pattern, lack of exercise, lack of motivation, and so on and so forth. And that can lead to, as a matter of fact, this improper lipid levels, blood sugar levels, rise in blood pressure, so on and so forth. So stress something is really important that can directly and indirectly influence heart. So we need to always advise our patients to avoid stress as far as possible and practicable.
Doctor, how can diet and exercise act as lifesavers for the heart?
Diet and exercise, they are really lifesavers, So actually, we Southeast Asians, particularly Indians, are fond of taking carbohydrate a lot. So that we need to certainly cut down on. We need to take a carbohydrate in moderate amount. We need to increase protein consumption and we need to increase the consumption of good fat, not going for the saturated ones. We need to eat lots of vegetables and fruits as well, and whole grains. At least 150 minutes of moderate exercise per week is advisable. Try to avoid stressful lifestyle, maintain our blood pressure, blood sugar, cholesterol, etc. All the risk factors within control, and we need to properly consult our physicians to have a grip on all these risk factors associated. But food and lifestyle, like exercises, are really of utmost importance in preventing cardiac problems.
Doctor, what small lifestyle changes can make the biggest difference for heart health?
Yeah, subtle lifestyle changes can make a big difference for sure. If you try to maintain a proper body weight, try to sleep for at least 7 to 8 hours at night, take proper diet, maintain normal body weight, try to keep your blood pressure, blood sugar, cholesterol levels under control. If you avoid smoking, if you don't consume alcohol and tobacco-related products, etc. And if you maintain a very much disciplined, well-organized lifestyle and take medicines as per the prescription or advice of the attending physician, and you can certainly prevent a lot of complications in the end.
Doctor, finally, your one-line message for World Heart Day listeners.
Yeah, the message for World Heart Day 2025 is don't miss a beat. Actually, this basically tells about caring about the heart, to remain vigilant about the defects in the heart, and we need to be very particular about getting this early symptoms. And we need to look for risk factors. We need to go for early aggressive treatment so that we don't miss out on a beat of us and as well as any of our relatives, friends and patients as well. So the message should be don't miss a beat. So every bit is important. So we need to be looking for every bit that should be there all the time. Thank you very much.
Doctor, how can patients recognize the early warning signs of heart disease?
Yeah, early warning signs of heart diseases can appear in different formats. So patients can remain asymptomatic as well as patients can feel mild symptoms like typical or atypical chest pain in the hands, jaw, at the back, and the central chest. And the patients can have a little bit of fluttering of the heart, like irregular heartbeats patients can feel. Patients can have compression in the middle of the chest, and some patients can feel like sort of giddiness or some sort of fainting attacks as well. Patients can feel very much fatigued. There are many typical and atypical presentations. But each and every symptom should be really taken care of, and everyone should remain alert about this sort of symptoms that can appear.
A public awareness initiative for healthy heart.
Heart beats, happy treats. Life's a joy on healthy beats. Keep it light, keep it smart. Walk each day and love your heart. Eat right, move more. Healthy heart you can't ignore. Skip the stress, take a start. Smile today, protect your heart.
By listening to Dr. Mrinal Kanti Guha, 29 September 2025 on Bigfm between 10 a.m. to 12 noon.
As every heartbeat matters for life. Happy World Heart Day.